We're talking to our patient from Costa Rica. You had a lap band 2 years ago, and yesterday we did your surgery, and when we went in, we saw the scarring around the band. The band is, if you can envision it, it's got a tail, and it grabs a hold of the stomach, and you can see that. You can see the stomach trapped with the band wrapped around it. Okay. So far, okay, because if we're to do that, kind of squeeze it off a little bit, maybe you would lose weight. You wouldn't eat so much. But what we saw in your case is not only the trapped area, but then we saw a bubble of dilated stomach above it. This is also called a slipped band. So the band should be tight right beneath the esophagus, and therefore the esophagus shouldn't stretch much. But the stomach is designed to stretch. You know, if you sit down to eat, think about how much you can eat. You could have an appetizer, another appetizer, and a salad, and an entree, and 2 sides, and cheesecake, and I'll help you with that creme brulee. And you know, all that food goes into your stomach, and your stomach, which starts off small, suddenly fills up and expands. Well, right above your band, which had slipped down a little bit from where it should be, it had a big bubble, so that it looked about like this. And so instead of looking like we'd like it to see, it looked like an hourglass with this tight, narrow waist, like a woman with a tight corset on, narrow and tight in the middle, and a big bubble at the top. And so we took out the stomach band, and then we tried to trim up the bubble and narrow it back to the normal gastric bypass stomach that I make, that long, narrow gastric pouch. And so hopefully we got it just right.
That would, and 7 feet you bypassed?
How much did we bypass?
Yeah.
We bypassed 8 feet.
8 feet.
Yes. Doesn't that seem like a lot?
Yeah.
Yes. When we started operating on band patients, we said, oh, a band patient is like our regular patients, but with a band. What we found is if we bypass the right amount for your weight, you won't lose much weight. We have to add to it because the band has somehow modified you. So we have patients where we bypass 6 feet and it works great for somebody that weight without a band, and it's not enough with the band. So if you have a band, we have to add 1, 2, or 3 feet, we think.
Okay. What's the total length of
the gut? About 26 feet.
So I still have plenty.
Well, there is, but your question is a good one. Is it too much? Could we bypass too much? Yes. Is it possibly too little? Could it be too little?
Yes.
Yes, it could be. Get amen from the back there, right? In other words, we bypassed too little in our patient for today. So when I'm operating, I have to use my judgment to guess the right amount. And our experience now, we've done hundreds of lap band patients, is we have to bypass more in a band patient.
Okay. That's good, man.
Yes.
I have a few questions that are very simple.
Yes.
Some time ago, I did a therapeutic fasting.
Yes.
In Spain, in
yes.
some place in Spain.
Yes.
And the immediate effect of the fasting was the increase of the uric acid.
Yes.
But astronomically.
Yes.
Now, the fasting there was very similar to the types of foods I can eat during the first 2 or 3 weeks.
Yes.
So is there a risk of stones and...
Yes. In other words, that's a really good question. Does uric acid go up after the surgery? Yes, it goes sky high. And let me see if I can explain why. Uric acid is a metabolic side product of your body digesting muscle and the cells in muscle that have DNA and RNA. The DNA, or deoxyribonucleic acid and deoxynucleic acid, are chemicals that when they're broken down in the body and excreted, release uric acid as one of the end products of that metabolism. And your body now, as we talked about the other day, is going to starve. Because you haven't had much to eat since yesterday, right? Okay. And it's going to be like that for weeks. So your body should be able to handle that. Your body for years has been storing up extra energy as fat. So when you're starving, your body should say, no problem, I'll be right back. I'll go downstairs and I'll withdraw from the bank account. I've been saving energy in my tummy and my hips and my chin for years, right? You don't do that. Your body doesn't do that. A heavy person doesn't burn fat very well. That's how they got to be heavy. So against our wishes, against your best, against your health, your body burns muscle. And if you could speak to your body, you would go, hey, do not burn muscle, burn fat. But your body doesn't listen because there's something wrong with a person who's heavy. Their hormonal mix is off. We don't want it to burn muscle, but tough. We don't have control over that. So in the first weeks and months, it's going to burn muscle. And when it burns muscle, it'll burn up the cells of the muscle. And the cells of the muscle have a centerpiece which is full of deoxynucleic acid and ribonucleic acid. And those get metabolized to uric acid. So uric acid goes up. So if you've ever had gout in the past, you usually have the worst gout attack of your life in the coming weeks. Have you ever had gout?
Never had gout. No, I just had extremely high levels of uric acid, and the doctor at that point said it was really dangerous because I could develop stones in a minute.
No. No, we haven't seen that. But it can, but it does happen, and so you want to drink liquids. You want to be cautious about making sure you're well hydrated, like we talked to you about. And you might ask, well, what happens? Well, in the end, your body gives in. If you go to the gym and lift weights, the first couple of months, maybe nothing happens. In a couple of days, you're not going to expect to look like Arnold Schwarzenegger, right? It takes a while to build that muscle. And your body ultimately will stop burning muscle. At one point, sooner or later, in the weeks and months to come, your body will finally say, okay, I understand you're not going to give me any more muscle. I have to go and burn some of this fat. And then your body will start actually putting muscle back on and burning fat. And when that happens, you may have a month where you don't lose any weight.
You increase weight.
Because you build some muscle, but you burn some fat, and you might go down a pant size. So if you look in say, March of next year, you might lose no weight, but your pant size might go down by an inch or two. And what happens there, people call me and they go, oh my goodness, oh my goodness, oh my goodness, the surgery's not working. And what's happening is the hormonal mix inside you is finally changing. Your body is finally saying, all right, I know you've got to have heart muscle, you've got to have breathing muscle and things like that. I'm going to give in and I'm going to burn some fat. And your body say, I know you want that muscle back, and so put it back. Now, one more thing to add to this. You can help make that transition. You can help switch from being catabolic, that is where you burn muscle, to becoming anabolic. That's where you build muscle. You can become anabolic by stressing your muscle a little bit, by lifting weights. A little. Don't overdo it, but exercise. And you may remember in our advice to you in the supplements, we recommend the creatine, the whey protein, and glutamine. These are all anabolic supplements that can help you build muscle. And when you build muscle, your body says, okay, I must go down to the storage locker and burn the fat. So take those supplements.
And then the next question is very simple. Do I need from you a discharge letter or something for the airline?
I don't think so. If you want one, you can have one, but we don't usually need that. No.
Okay.
No.
Okay, that's good. Next, I'm having a high level of an acid feeling.
Yes.
In the throat and
yes.
I don't want to throw up, but I feel all the liquid here.
Yes.
Is that normal? Should I take something for that?
Yesterday, while you were asleep, a masked man crushed and stapled and cut through your stomach. And so that hurts. And that feeling is me. That's the surgery itself. It's damage to the stomach. It's damage to the area just beneath the esophagus. And what's surprising is not that you have that pain. It's surprising you don't have more pain.
Yeah.
Because imagine, just to think about it, imagine that we crushed and stapled the tip of your finger. Can you imagine how painful that would be this morning? And what would you think about the person who did that to you?
I'm sure you've heard it before.
Yeah. And so what's amazing is not that you have some of that burning pain. That is expected because of the magnitude of the trauma and the injury to the stomach. We crushed and stapled. We ripped out an old plastic band that was around the stomach. And so it is traumatic. It is injurious. What's amazing is you look around and look at the other people. I mean, you look wonderful. You're sitting there like this with the arm out like this, and you know, you just look at ease. And Mark looked this morning like he looked yesterday. So you look like you're doing well. Some pain, some irritation makes sense. Again, think of our patients in clinic on Tuesday. Remember, there were several people who had no pain, but there are several people who had a moderate to a lot of pain. And that goes with the territory. We apologize that you have any discomfort at all.
It's acidity. It's not a big deal.
It's not acidity. It's just your feelings. Your body is trying to tell you what it is.
Okay.
It's saying acid. What it wants to say, but doesn't have the vocabulary, is Dr. Rutledge crushed me and stapled me, and I'm really annoyed.
Okay.
It's you stepped on a tack yesterday. Now the nerves going to your body can't differentiate much, because when God created us, the nerves that go to the abdomen and the stomach don't have the capabilities that your fingertips do. There's no optic nerve, so you can't see it. Because you don't have the nerves that are in your fingertip, you can't tell the difference between things. Your fingers are amazing. Cold, warm. You can't tell cold or warm inside very well. Soft and hard, sharp and dull. That's because there's so many different kinds of sensors in your fingertips that are not in the abdomen. The abdomen can go, gas, burning.
Yeah.
That's it.
Okay.
So it feels like acid. It's not acid.
Perfect.
In the way, it is kind of acid because the area is cut and raw and stapled. But if it could really talk, it would say different things.
Okay. And finally, to let the other people ask as well, the drugs I have to take during the next week that I'm in Vegas and afterwards, do I get where do I get the recipe, or how do I go about?
You'll get some discharge instructions. It's in the manual.
They're going to give them to me on the first floor?
And you'll get another copy from us, yeah.
Okay, so I want to buy drugs for 6 or 9 months. I live far, so
Okay, but they probably have the drugs in Costa Rica.
it's possible. Yeah.
Yeah, they're not wild drugs. They're very common drugs.
Okay.
Nothing special. There's nothing special you need to pay American prices for. I might come to Costa Rica and buy the drugs there.
Let's get a business.
That's right, that's right. We can have everybody fly through Costa Rica on the way home, go to the beach, get the medicines, and come home.
Go to the lawyer, of course.
Go to the lawyer, yes. Go to the lawyer. Mama, any questions? No?
I don't know what you did to him, but he's very private, and he even came with the gun today.
Yeah, good.
I'm surprised.
Yeah, good.
I'm surprised. He doesn't care anymore.
Good. All right, good. Let's see, who was next yesterday? Oh, yeah, Linda, you did terrific also.
Most of the bypass.
Let's go look, let's see. Okay, your surgery took 45 minutes, and we bypassed a little over 6 feet.
Okay.
Yeah, almost 7. Mild fatty liver, so not too bad, so that's good. And no difficulty. Surgery took 45 minutes.
Is that, well, most of them are 30, aren't they? So,
Yeah, you know why?
What?
Do you remember something that happened 2 years ago that left a scar on your abdomen?
Oh, yeah, I'm done.
So she didn't even tell the doctor, the anesthesiologist, but she has a big dueling scar on her side here, where some surgeon got her a few years ago and took out your gallbladder. So
Years, yeah.
that leaves how many years ago, you think?
Well, it was in 1972, so.
So 30-some years ago.
Yeah.
Yeah, and so that's before laparoscopic surgery. And I was just a little surgeon at the time.
Yeah.
And,
That does make perfect sense then.
yeah, so it took about an extra 15 minutes to get around the scar tissue there.
Yeah. Is there a lot in there? Or?
It's medium. If your mom has been in when you go back after previous gallbladder surgery, and there's a moderate amount in the upper right side where your gallbladder was, and we are operating on the upper left side, so it was kind of out of our way. But we have one port that has to go over there, so we had to fiddle a little bit to get around it and cut a few adhesions, but not bad.
My apologies, but thank you very much.
No, you don't have to apologize.
No, but
Not at all, not at all. We were very happy. Everything went smoothly. How was your night?
great. I was walking a lot tonight, so.
Yeah, you look pretty amazing.
Oh, well, thanks. I feel pretty amazing. I'm just glad it's over.
Yeah.
It was a great experience.
Any questions? Anything that's not clear?
Well, we were happy with